Ms Franks.
Mr President, I move that this bill now be read a second time. This bill, the Healthcare Health Access Zones Amendment Bill 2019, is a simple bill in that it seeks to establish health access zones to provide protection for abortion care in our state. It is not a new concept. In fact, as a state, we stand alone now with Western Australia as being the only Australian jurisdictions yet to have such abortion and reproductive health care safe access zones. In Queensland, their safe access zones commenced in December 2018 and they stand at some 150-metre buffer with a $2,611 or 1-year imprisonment penalty. In New South Wales, their safe access zones commenced in June 2018, again 150 metres, a first offence providing a penalty of $5,500 or 6 months imprisonment, or both, or a subsequent offence demanding an $11,000 or 12-month imprisonment, or both penalty. In the Northern Territory, they've had safe access zones since July 2017, again of 150 metres, with some $15,500 or 12 months imprisonment as a penalty. In Victoria, their safe access zones commenced in July 2016, again 150 metres, with a $19,342.80 penalty or 12 months imprisonment. The ACT commenced in March 2016 with not less than 50 metres, but I note there is one specific facility that their law covers and one specific set of circumstances. The prohibited behaviour brings a penalty of some $4,000 and publication of visual data a penalty of $8,000 or 6 months imprisonment, or both. And in Tasmania, they've had safe access zones since 2014 in February, 150 metres buffer with a 12-month imprisonment penalty or a $12,225 fine, or both. So as you can see, Mr President, we lag behind in South Australia, but that doesn't mean that we can't have, I think, the best safe access zones in the nation sometime soon. And this debate is a timely one because, as we know, the South Australian Law Reform Institute is currently waiting to present for the edification of Parliament and the information of those members who will soon vote on legislation, a report on abortion law reform in this state. Originally, that debate was commenced with a bill that I have still on the notice paper before this place, which indeed not only seeks to decriminalise abortion, but to provide for safe access zones. The bill before us today is very similar with the provision of that particular safe access zone model, with the addition that while a 150-metre buffer zone may be declared or indeed enshrined with regards to the Woodville Pregnancy Advisory Centre, that distance may indeed be extended by gazette of the minister where an additional buffer zone is required, similar to the ACT experience. The bill is quite simple. It provides for health access zones. It provides that under 48C that the minister may declare premises to be protected premises. Under 48D that certain behaviour be prohibited in those in those health access zones, colloquially known as safe access zones, but in this bill health access zones. And 48E provides that a police officer may direct a person to leave the health access zone. It is a very simple bill, but as I say, it is a timely one because we will soon debate law reform with regards to abortion in this state. And yet we still don't have safe access zones in this state to protect those who seek abortion care. This bill will support women's reproductive health choices by ensuring that patients who seek to access health services that provide abortion can do so without harassment, without intimidation, without fear and without obstruction. The member for Hertel Vale and I have worked together to prepare and co-sponsor this piece of legislation, and she moved in the other place the same bill just this morning. We have done so, of course, with the support of many other members in this place and the other place, as well as, of course, the fine work of the South Australian Abortion Action Coalition. This bill will protect patients and clinicians alike. The staff who work in reproductive support services deserve a safe workplace. Currently, that is not guaranteed. An important factor to consider as well, as we consider this, is that this bill may not be the perfect bill. Soon we will have that Sowry report, and certainly many submissions have been made, including that by the Law Society, the Human Rights Law Centre and many other, no doubt, quite credible organisations that may inform the final version of this bill. But what is important is that we provide that safe access before the heightened situation of a debate about abortion begins. It is also timely because today is the first day of an event that takes place in South Australia and across the globe twice a year. The event is called 40 Days for Life, which seems innocuous, but 40 Days for Life is a global movement designed to close down reproductive health care across the globe. And here in South Australia, that aim and that effort is no different. Protesters outside places such as the Pregnancy Advisory Centre down at Woodville, but across the country and across the globe until safe access zones have put that buffer of protection for patients and staff alike. In this coming 40 days and in a 40 days around Lent, protest with placards, with harassment, with intimidating behaviour and impeding not just patient access to health care, but providing a difficult workplace for healthcare providers doing a difficult job who deserve the support of Parliament, and I hope that through this bill they will get it. I put in a Freedom of Information request for complaints made to the Charles Sturt Council with regards to the 40 Days for Life and other similar protests. I did indeed get it very quickly. It was one of the quickest FOIs I've ever got in my time as a parliamentarian. I suspect some people at Council would like to see a bill like this passed with great haste. That Freedom of Information request, which provided information for the last few years from the City of Charles Sturt about the activities of those protesters outside the Woodville Clinic, is enlightening reading. One of the website complaints that was made on the 1st of October 2014 reads, "I recently attended the Pregnancy Advisory Centre in your council area as a support for a family member of mine. Upon arrival at this location, there was a small group of protesters across the road from the facility, clearly making their intention of being there with their signage. I found this absolutely appalling and disgustingly judgmental by these people. I understand everyone has the right to protest, but there was a lot of women from all age groups and backgrounds attending this facility, and the look on some people's faces, especially the young women visiting this service, was horrific. These people are entitled to their own beliefs, but I do not believe Council should let them stay where they are. They are making a difficult situation even more difficult for these young women and the people supporting and attending with them, not to mention the staff who are the subject of their stares and belittling comments as well." A further revelation is some correspondence to the Charles Sturt Council, which is undated in the FOI, but goes to report to the Council's permit officer. I think it may be February 2015. I write in relation to our recent conversations about the presence and location of protesters, brackets, curbside crusaders, outside the Pregnancy Advisory Centre. And it goes on to give the address. My understanding of the permit conditions are that the protesters remain within the erected bollards and not to approach or engage with people attending the Pregnancy Advisory Centre. I am mindful of the resources required by the South Australian Police and the City of Charles Sturt in the monitoring of compliance with permit conditions, and hence I do not report every breach. In the last 2 weeks, Pregnancy Advisory Centre has responded to a complaint to the Premier's Department about the protesters' presence, responded to the distress experienced by attending ambulance officers who were filmed on a mobile telephone while leaving the site, and staff have provided clients with support who have reported being verbally harassed and intimidated when entering the premises. The content of the verbal tirade is incorrect and seditious. Domiciliary Care, who own Pregnancy Advisory Centre building, have previously reported a male person blowing a trumpet, creating a noise hazard, and people have wandered to the rear of the complex to peer into the back doors of the Pregnancy Advisory Centre. The protesters attend twice each year for 40 days and are present in smaller numbers every week throughout the remainder of the year. So there is always a presence. The issues cited above are not new. However, I have a responsibility for the safety and well-being of clients, staff and other professionals attending the service at any time. I feel the responsible approach is to lodge a complaint about the behaviour of the protesters. I also seek your consideration about the conditions of a future permit request in light of persistent breaches of permit conditions over many years with no observable repercussions. Maintaining safe access to abortion services is a concern for women, service providers, police and governments, and is not isolated to Adelaide. The death of a security guard outside a Melbourne abortion service prompted what is known as an exclusion zone. Other states in Australia have since imposed, by law, a minimum exclusion zone for protesters to be 150 metres from the service to enable clients attending unhindered access. The South Australian Police has advised me that the protesters are the responsibility of the local council, and I request your consideration for a 150-metre exclusion zone as an interim measure in response to persistent and consistent permit breaches. A further revelation under FOI, a summary made in 2016 in March, on the 8th of March, coincidentally International Women's Day, thanking the person from Council for the meeting and then going on to say, I am keen to reiterate that I appreciate the support you have previously provided over many years and are currently providing to clients, health professionals and staff attending the Pregnancy Advisory Centre in relation to the prayer group 40-day vigil adjacent the premises. As you have requested below is a summary of concerns that have been raised and incidents that have occurred during the current vigil and the previous vigil in late 2014. This is not exhaustive and highlights the main concerns. Inappropriate name-calling, child killer, going to the devil's advocate, as reported by staff by clients. PAC staff frequently responding to clients who experience distress, frustration, tearfulness and anger when having been approached by members of the prayer group. A support person felt exceptionally distraught when approached by the prayer group. He stated, I don't know what I would have done if I had not spoken to you, the counsellor, today, raising PAC's concerns for the safety of the others and the prayer group when they chose to engage. Filming ambulances leaving the premises and previously posting on a website ambulance officers expressing their anguish at being filmed. People seen standing at the rear of the property, peering to look at the back doors of the building and frequently positioning themselves outside of the erected perimeter requiring monitoring by the council. So as you can see, despite council's best efforts, the protesters continue to flaunt the permit conditions and continue to harass staff and patients alike. I note that many instances of the correspondence covers pictures which look to me to be intimidating and harassing and threatening, and certainly are not what one would expect when one goes to seek health care in this state. A further piece of correspondence dated June 2017 is indeed from a local resident. a complaint to the Pregnancy Advisory Centre was made by this local Woodville resident as a woman was walking her infant in a pusher at approximately 2:30 that afternoon, Tuesday the 27th of June. She was unable to get past this group of 4 people who were protesting outside the Pregnancy Advisory Centre on the footpath. She did not have her phone with her, and so she came into the centre to seek advice, as she has previously made complaints to the council about these protesters impeding her, and was asked if she could take photos the next time she encounters this. I note that it doesn't seem to matter whether or not somebody is accessing the healthcare, or indeed that they've had a baby and they live in the local neighbourhood, that these protesters see fit not to respect their rights. Everyone does have a right to present their views, and this bill does not impede upon that. Indeed, while a patient's ability to freely access health services without fear of intimidation or harassment is, of course, an important consideration, it is balanced, I believe, here with the freedom of communication that are implied in the Commonwealth Constitution. However, any implied freedom is not absolute. It is permissible for legislation to impose restrictions or burdens on that implied freedom where indeed the purpose of the law is legitimate, as I believe this one is, and indeed that law is appropriate and adapted to advance that legitimate purpose. That is a summary of the current WA Health Department's documents consulting on their soon-to-be announced safe access zones in that state. I note also that the Law Society, on the balance, has assessed and provided feedback to the current salary debate, and I draw members' attention to their feedback on safe access zones. There will be a balance between freedom of communication, but also the right to access, without harassment, without intimidation, healthcare in this state. And that is also a human right. The right to access healthcare is a fundamental human right, and they are not mutually exclusive. I note that members may have concerns about those particular conflicting rights, and certainly should there be amendments to tighten up any parts of the language of the bill, I look forward to those contributions, and I hope those contributions will soon be informed by the salary report to provide some of that definitive work. Again, I look forward to this bill's passage in a speedy manner and in a considerate manner to ensure that we protect the safety of those patients who currently run a gauntlet of protesters to access healthcare in our state. We have a fine tradition of accessible healthcare, and particularly with regards to abortion in this state, despite our criminalised laws, and public provision at very minimal, if zero cost, is an important part of our proud tradition there. But when it comes to debating these laws, we do know that all of those traditions will count for nothing and will not give those patients accessing our quality healthcare system the protection that they deserve and that we should be giving them. Right now, this very day, the New South Wales Parliament is debating the decriminalisation of abortion. In that debate, we've seen extraordinary measures taken. We've seen protesters loudly protesting on the steps of Parliament House, as they have here, and as is the place that they should hold those protests. But that freedom to protest should be confined to the steps of Parliament or to our public spaces and parks designed for such a purpose, and not to impede those who are simply accessing healthcare at an extraordinarily difficult time of their lives. They deserve our support. They deserve to be protected, and I hope that this Parliament will ensure that that protection is enshrined before we move much further with the decriminalisation of abortion debate. With those words, I commend the bill to the Council.
Mr Stevens.